I'd like to welcome you to the Medical Marijuana Awareness Seminar Series. Today's topic is going to be anxiety and stress. And I know that in today's market, in today's environment, I should say not market, but environment, um, anxiety and stress are something that everybody is hearing a lot about. I know that the quarantine environment is just something, this whole COVID quarantine thing has really caused a lot of people a lot of stress and anxiety, not to mention, elections and the fact it's wintertime and having kids home. And there's a lot of things that come into play today. Um, Cannabis has been effective in medical cannabis, especially, has been effective in addressing uh, both anxiety and stress. And we're going to talk about that today. But I think more importantly, what I'd like to do is I'd like to introduce you to someone who is going to co-host this with me, a gentleman that has been around the medical cannabis space for a while and seen a lot of cases and has a lot of background in it, and a guy who I've worked with in the past and really respect, is Alex Ford from Trulieve. So, Alex, tell us a little bit about yourself.
Hey, Marc, thanks for having me. Really appreciate that. I'm a community educator with Trulieve in the Central Florida area. So I work with the physicians in the Central Florida region. I've been doing that for a few years now. So I have spoken to quite a few patients and doctors along the way. So I do know a thing or two. And stress and anxiety is definitely a very, how do I say, popular topic for medical cannabis patients, and one of those issues that kind of hits home for me as well. So I'm excited to dive into it and see what we can help educate these patients on.
Yeah, I think we see a lot of this going in the market today. So, what I'm going to do is we're going to go over to some slides. And I'm not trying to make this a slideware presentation, but I do think there's some information that we may want to share that'll be able to help us help further the discussion. And what I want to point out is that we're here to answer your questions. And so you'll notice at the bottom of the screen, you'll see like two little bubbles. It says Q&A. Please feel free to put in information and ask us questions in the Q&A area. I see there's a chat capability. Some people have put some questions in the chat. And more importantly, I think we've seen a lot of people coming in from a lot of interesting places, Kentucky, Puerto Rico, villages, Port Charlotte. So anyway, thank you all for coming. And so let's dive into stress and medical marijuana. Um, it's interesting. What I want to point out is one of the reasons why we do this is we want to make sure that you understand that whatever you're doing, always consult your physician. It has to do with your health, and we want to make sure that your physician, especially, is part of your advising group. But what we're really talking about here is we're talking about the safe use of medical cannabis. And that's something that's really hard to find out sometimes because it's hard to find out information about medical cannabis. Why did we put this on? Well, I started doing these in seminar form about 4 years ago, and my goal was real simple. If I can help one person get their life back, if I can help one person get back to the life that they had before or pretty close to it, then we think we've been successful. We're really here to answer your questions, and we're really here to really dive into this subject matter and talk about it. So please feel free to ask the questions, and hopefully we'll be able to help with your particular situation. Now, stress and anxiety are interesting. They're interesting to me in that anxiety is something that's a persistent feeling of dread. That's something that people have. It's not, if you have it, don't think that you're alone. It's estimated that 264 million people worldwide have some sort of an anxiety, what they call a disorder. I don't call it a disorder at all. What I call it is it's a condition. It's something that's there. 31% of the adults in the United States, sometime in their life, will experience anxiety in one way, shape, and form. It's something that's it's something that's there. You feel dread. It's not necessarily from something that's threatening. It's just something that comes on with illness, with something that's physical, something mental. Life is just life. And so, what do they call it? Well, when you look at anxiety, they have a lot of different words for it. They can call it panic disorders, they can call it phobias, they can call it social anxiety, OCD, PTSD. Say what you want. It's this condition that people have. And again, you're not alone. It's a normal condition. And don't think that you're doing something or you have a condition that you're unique. Now, stress is a little bit different. Stress is something where your body and also your mind are trying to respond to some sort of a challenge, whether that's work, whether that's school, whether that's something that has to be done around the house, whether it's the kids, the car, whatever is out there. There's some sort of a traumatic event that causes stress in your life. And stress is something that's interesting in that not only does it affect your health, it also can bring on headaches, high blood pressure, chest pains, skin rash, loss of sleep. There's a lot of people that when they get into stressful situations, not only does their blood pressure go up, some people even have been hospitalized because of it. It's something that is very real that's out there. Now, stress affects everyone. You're not alone if you have stress. And in this particular environment today, with we have all the quarantining and all the different things going on, stress is something that's we're definitely living with. I know that we're coming up on like 10 months of being in a quarantine environment, and we're not used to it. At least me and my family are not used to it. It's something that it bothers you. But stress is interesting in that it can be both good and bad. In one way, it can be an intimidator. It can be something that gives you that high blood pressure and can give you something that bothers you. In certain ways, stress can also be a motivator. It's kind of one of those things that says, "Hey, you got to get something done here," and it kind of motivates people. It sounds crazy, but I started playing competitive golf at an early age, and I played a lot of it, some of it professionally. And I found that at an early age, I had a coach who allowed me to channel my stress and actually made it a motivator. I played better under stress than I did just practicing. And again, that came through track. It came through a person who knew what he was doing, and coached me on it. But stress can also be something, again, that's a motivator, very different than anxiety. Anxiety is just a condition of dread. Stress is something that can get you to pay attention, to focus on things, and go forward. One things we do want to point out: if you are overwhelmed by stress, if you are in a situation where stress is really something that's bothering you, it's something that's dominating your life, get help from a professional. Talk to a healthcare professional. Talk to somebody. Stress is physical and it's mental, and it's in response to an external cause. Please feel free to talk to people. You can get a hold of healthcare professionals. This is something that you should really address. Same thing with anxiety. But anxiety is something that's ongoing. It is escalated by stress, but it's something that's there. And the question is now, in both cases, what can you do about it if it's something that's there? Um, Research is interesting because what's interesting is that we all have something called an endocannabinoid system, and some of you may not know what that is and haven't heard of it. And we'll talk more about it. We'll explain how that all works. But the endocannabinoid system works hand in hand with the nervous system in your body. It plays a very important role in your body being able to regulate itself. And it's something that, because the endocannabinoid does allow your body to regulate itself, it helps to be able to control anxiety, fear, stress in response. It's something that is, how should I say, it's something that you have that is a natural way your body works, and it can help you both positively and negatively. And mainly the endocannabinoid system helps you positively, which is very, very interesting. We'll explain that to you as we go along. And we found that people that suffering from both chronic pain as well as PTSD, by using cannabis, have been able to reduce the amount of anxiety-related symptoms that they have. So it's something that's been studied, namely not here in the United States because cannabis is a Schedule I drug. We can't do the studies, but it has been studied overseas, in Israel, in Spain, and in the UK and those kind of places. So it's something that has a proven result. Also, there's something that's tied to cannabis called terpenes. Terpenes are very similar to essential oils, and they come in the cannabis plant. And these terpenes actually help a lot to be able to address issues like anxiety and stress. And there's a published study that's been done recently. It was done in January of last year. It actually shows that cannabis, especially, it can be used to be able to regulate and to be able to reduce the amount of anxiety that you have. There's a direct connection between the connectors that respond to medical cannabis and the frontal cortex and how your body works. So there is research that's out there. This is not something that a couple of guys in the back room kind of made up. This is something that scientifically people have taken a lot of look at. Now, let's talk about anxiety and stress and CBD and THC, because when it comes to high THC based cannabis, a lower doses of THC can help with anxiety. But if you take higher doses of cannabis, it can actually bring on anxiety. Now, When we say higher and lower, it depends on you and your body. It depends on how you react to it. Every person is different. So, someone else's low might be somebody else's high and vice versa. But but it's interesting how THC has both. It's a two-edged sword. One can be help you with it, and one can worsen it. You've probably seen a little bit of this, Alex, in your practice.
Absolutely, yeah. It's very important to remember that THC is, at the end of the day, it's still considered a stimulant. So if you are suffering from anxiety or panic, being stimulated can trigger anxiety or panic episodes. So it's always great to kind of start with CBD no matter what. That's kind of the mantra of the industry, is to start low and go slow. And that would be with, typically products that are higher in CBD.
It's interesting that higher doses, they found that higher doses of CBD can help reduce anxiety. Also, higher if you are having a panic attack or something, anxiety being brought on by CHC, you can use CBD to reduce it.
Exactly. CBD is anti-euphoric, anti-psychotic, so it can, or psychoactive, sorry, so it will mitigate the strength of the euphoria you're feeling from the THC, as well as reduce the amount of time that you're experiencing that uncomfortable feeling.
Yeah. So, THC cannabis has been shown to be anxiety reducing, but it also can be anxiety inducing. So this is something where you want to go low and you want to go slow. Work with your doctor, work with your medical marijuana doctor, work with your bud tender at your dispensary, but more importantly, work with yourself. Your body will tell you how sensitive you are or you aren't to THC and to cannabis. And again, I draw this parallel directly to alcohol. I have friends of mine that really one drink and they're done. I have other friends of mine that can drink the whole bottle and they're still good. And it just has to do with your body and how they react to it. And the same thing is true for cannabis. Some people are extremely sensitive to it, and some people, they can take more of it if they're not as sensitive. This is where you got to dial it in. When you go to a party and you're going to have a drink, you know how to dial it in. That's because you've tried things both positively and negatively. Same thing here. What you want to do is we want to dial it in, and we want to stay away from the negative side. So that's why we say go low and go slow. Start with a 1-to-1 CBD to THC, and then as you begin to see how you react to it, you can increase both the dosage amount as well as the amount of CBD and THC to address the situation that's there. Again, work with your dispensary, work with your doctor, and more importantly, listen to your body. Your body will tell you how to dial that in.
Yes, and just to highlight that note, to be careful with the edibles. We'll go into more of that later, but it just is a much longer lasting type of effect, and it is metabolized differently than something that you would inhale. So just definitely be careful with edibles and anything that you ingest.
Right. Yeah, and there's almost everyone has gone through the experience where they because it takes a little bit longer for the edibles to kick in. They try a quarter of a brownie or half a brownie, and when it doesn't work, they try the whole brownie. That's not what you want to do. Just give it time. Just be cool. Give it time. It'll work. Would you say, Alex?
Said be patient.
You be patient. Yeah, exactly. It's there. Now, medical marijuana. How does cannabis react to a lot of the anti-anxiety medications? Well, the SSRIs that you have out there. So these are the Prozacs, the Zolofts, those types of things. There is few adverse interactions between cannabis and those particular drugs. In other words, there's been experience in people using them. There's been very few interactions that are negative. It would be pretty safe to say it's safe to use them with them, but just again, be careful of how it affects your anxiety and how your body reacts to it. It's something that's there, and the same thing is true with the NDRIs. And this is the 450s, the Wellburns, those types of things. Again, they are. You can use medical cannabis, and you can use those particular drugs, but you'll find that there'll be few adverse effects that come out of it. And what you might want to also find out is that as you're using medical cannabis, you might be able to reduce the amount of pharma drugs, and you might be able to reduce the amount of anxiety that you have, and basically get off the pharma stuff and get onto something that's more natural. And but don't do it right away. You want to be able to do it, as your body tells you and as you feel the way to go, it can be able to help you. What do we have to be careful of? Well, we'll show you a little bit later, but the way the cannabis works is through your bloodstream, your endocannabinoid system. Your body produces endocannabinoids, and when it does that, that addresses the condition in your body that it's trying to go after, whether that's inflammation, pain, digestive system, or whatever that's there, and it's distributed through the blood system. So anything that has to do with blood, so Xanax, Ambien, those types of things, you have to be a little bit careful. And this is where you really want to work. We have your medical marijuana doctor and your medical doctor work together. Classically, what they do is they reduce the amount of blood pressure. They typically reduce the amount of both pharma drugs and increase the amount of medical marijuana drugs, but they start out very low. In other words, they don't do it all right away. It's done over a period of time. It can be used, but I really recommend that when you're dealing with anything related to blood or your heart rate, your blood pressure, consult your doctor and your medical marijuana doctor. You got some comments on that, Alex?
Absolutely. Always consult with your doctor. Keep in mind that, the dispensary staff, as well as myself, we're not licensed medical professionals. So, it's definitely always consult with the doctor first and foremost and follow their instructions. And then, use the advice you receive from the consultants to help guide you.
There you go. Yeah. But again, most of the time, in most of the anti-anxiety medications, cannabis is okay. Again, the only one you have to worry about is if you're on anything related to blood thinners or something like that. Now, we talked about the endocannabinoid system, and I don't know how much people know. I don't know how much you know about it, but it's worth spending a moment here because when we talk about anxiety and stress, we talk about how cannabis can help with it. It's important to understand how it works and why does it do that. In your body, every person's body, every mammal has CB1 and CB2 receptors throughout their entire body. And you can see by the chart over here, the different the locations of the CB1 and the CB2 receptors. Your endocannabinoid system works with CBN, CBD, THC. They almost like a lock and key with the human receptors. In other words, they work together to be able to modulate things like pain, memory, appetite, inflammation, your immune system. This is how your body regulates itself. And we'll show you exactly how that works in a minute. But these two receptors are something that are really critical to your body. The CB1 receptors are primarily found in your brain and your nervous system. CB2 receptors are primarily found in your internal organs, okay, and it's associated with your immune system. So you have these receptors that are in your body. They are there to be able to help your body regulate itself. So how does that all work? Well, you produce endocannabinoids. You are a marijuana plant, essentially. You're producing endocannabinoids. When your brain sees a condition, what it does is your brain says we need endocannabinoids in order to be able to treat this particular condition. And there's also different there are also different things in your body that actually play in this. Amandanides, for example, they actually play in this particular party to help your body regulate itself. Now, there is cannabis, which are called photocannabinoids. And what they are is photocannabinoids are cannabis. This is what you get from Trulieve, for example. And what you're finding, these are the buds, the tinctures, the extracts, the CBD, the CBTHC, the CBNs, whatever that's out there. Why would you take that? Because in certain cases, like for example, myself, I'm a senior citizen. What I have to do is I have to be able to, my body's not producing the same amount of endocannabinoids as when I was younger. When I have a particular condition, and in my case, I have herniated discs in my neck from an auto accident, I need to have maybe a little bit extra help to give my body a little bit extra help in order to be able to address the pain and the inflammation. So this is where cannabis works with your body in concert, and we'll show you exactly how that works in just a minute. Now, there are also synthetic cannabinoids. This is where pharma companies have actually gone out and they want to be able to produce or try to produce cannabis itself. They want to patent it so they can basically charge more money for it. An example is Miranol. Miranol, for example, is only THC, pure THC. So it has no CBD in it. It's something that's very, very, you have to be very careful. Only use it when under a doctor's care. And I can't emphasize that more. These synthetic drugs should really only be used. They're basically pharma drugs. I just have a particular prejudice, and I'll tell you exactly what it is. I don't believe pharma companies can reproduce an apple. I don't think they can produce a pear, a banana, and they certainly can't produce a plant like cannabis. Cannabis has over 480 medical properties. They may be able to produce some of them, 30 or 40 or maybe 50, even 100, but they're not going to give you the same benefits of the plant. And obviously, it's something it's going to be a lot more expensive. But anyway, you'll hear about them. You'll see them out on the markets. I don't recommend them, and be very careful of them, because there's something you'll see in a minute why you have to be very careful of them. But your body says it has a problem. Your endocannabinoid system down here says we have a problem. And so what they do is it produces the endocannabinoids, again, to control appetite, pain, pleasure, sensation, your immune system, your mood. This is how your body regulates itself. How does that work? Well, you have your brain-derived endocannabinoids, and of course, you might have taken some medical cannabis. Those go directly into your fatty acids. So in other words, there's this perception that cannabis goes into the CB1 and CB2 receptors. They in fact do not. They go into your fatty acids. Your neurons, your nervous system, will notice that you have a problem in your body. It could be inflammation. It could be pain. It could be something from a digestive tract. It could be a number of different things. And when it sees that particular problem, it goes to the fatty acids and it produces long chain fatty acids that are then distributed in your blood system, to your bloodstream, to that particular part of your body. Now, this is important for a couple of reasons. First of all, this is how cannabis works, but it explains why no one has ever died using medical cannabis. You've heard of deaths from opioids, you've heard from deaths from a lot of different drugs that are out there. There's never been a recorded death from using medical cannabis. And why is that? First of all, because it's your body producing its own medicine. Your body is doing what it does naturally. There's no foreign substances. There's no alien substances entering your body. Your body's just doing what it does normally, which is why it's called a holistic medicine. The other thing that's interesting is that your body knows where you have a problem. Your body doesn't need a doctor to tell you, I have inflammation in my knee and I have pain in my shoulder. Your body knows you have those things. So what the body does is it says, okay, I'll produce some endocannabinoids for the inflammation in the knee, and I'll also produce some endocannabinoids for the pain in the shoulder. In many cases, patients will say, look, I'm taking it for one thing and it solved another. In the case of my mother was taking it for breast cancer. And when she went to the glaucoma doctor said, you don't have glaucoma, it's gone. And he asked what she was doing, and she said, I'm taking medical cannabis. And he said, well, it works for that. Her body knew. She didn't need a doctor to tell her that, what to do. Your body just knows how to take care of itself. So this is important from the standpoint of understanding you're not going to die from it because it's your body doing its natural thing. And in fact, it may help you with other ailments that you have, things that are just nagging throughout your whole body. You have any comments on that, Alex?
Yeah, absolutely. Cannabis is something that is completely safe, especially when you have the transparency that we do in the Florida market, and especially with Trulieve, with our third-party independent lab testing results for every single product, so you know exactly what you're getting. So you don't have to have any worries there. And as well, the only way to die from cannabis is if you get crushed by a ton of it, or, if you choke on some. So, even if you do find yourself where, maybe you have a little bit too much THC, don't panic, find some CBD, just stay calm, and it will subside. And keep in mind, everyone is going to be different in terms of effects, like Marc said. But this is, something that's your endocannabinoid system regulates homeostasis. So like Marc said, if there's extra cannabinoids in your body, your body's going to take them where they're needed.
Exactly. And this is important. Your body will control yourself. That's why I always recommend for medical cannabis patients, listen to your body. Your body will tell you what to do. Your body tells you what to do when you take pharma drugs. Candidly, it tells you what to do when you have a drink. Just listen to what's here. This is something that will help you in many, many ways. Let's dig down into what cannabis is and how it works. Alex, what's CBD and what's THC?
Yeah, so those are definitely going to be the two most popular cannabinoids that everyone's probably heard of by now. So in terms of relating it to something that we're all familiar with, I like to consider in terms of pain relief, CBD is like a anti-inflammatory, a aspirin or Advil type of alternative, where your THC is going to be more so your stronger pain reliever, which would be more like an opioid alternative. And like we mentioned before, it's important to keep in mind that CBD is not only non-psychoactive, it is anti-psychoactive. And that is found in hemp as well as medical cannabis, and you can find hemp-derived CBD over the counter, so that is available for sale, but it does differ from our products that are high in CBD, because there's a different threshold of the trace amounts of THC that's allowable in those. So it's always important to keep that in mind. And also the over-the-counter CBD industry isn't as regulated, obviously, as our industry as well. So it can be difficult to find, a good CBD retailer. So if you are taking over-the-counter CBD, just keep that in mind.
Sure. So let's take a look at this. This is what they call the CBD wheel. It's kind of a famous little wheel. It kind of explains the different, let's just say, components of cannabis and what they address. You want to talk to this point?
Yeah, definitely. So like we just covered the CBD and the THC, right? And the THC that we covered is going to be in the kind of the top right where it says Delta 9 THC. That's going to be just typical THC, okay? Now you'll see there's different types of THC. You've got Delta 9 THCA, which is THC in its raw form. It is not psychoactive in that form and requires heat to become psychoactive or euphoric. Then we have Delta 8 THC over here, which is another isomer an isomer of Delta 9 THC, which mimics properties of CBD as well as THC. So it's kind of like what I like to call a tweener. It's less euphoric, but still great for a lot of things, including, pain, headaches, cramps, nausea, spasms. And then you have THCV over there, which is always gaining popularity. Because as I'm sure you guys are aware, it's pretty well known that, cannabis typically increases your appetite, or, gives you what's known as the munchies, if you will. And the great thing about THCV is that it's actually an appetite suppressant. So if you are consuming products that are high in THCV, theoretically, they will not give you the munchies and maybe even, reduce your appetite, make you less hungry. Now, also just to kind of throw this out there, cannabis use in the long term does kind of lower appetite overall. So, if you're very new to it, you might notice those effects are very prominent. But as time goes on, as you gain a little bit of a tolerance or your sensitivity gets reduced, that will subside. So always keep that in mind. And then there's also different forms of CBD. There's CBDA, and then we have other cannabinoids like CBG, CBC, and then one that I do want to point out as well is CBN. That one didn't make it on the wheel, but we actually have those in capsule form, and those are great for a number of things, the most notable being sleep. So if anyone here is having trouble sleeping, CBN is definitely a great place to start on its own. It does have reduced euphoria from THC significantly. It's a great alternative for THC actually, but combined with THC is when you really get the benefits for sleep. And it's also a powerful potentiator. So, obviously a big part of this program, for a lot of people is to help reduce the amount of pharmaceuticals like we've already touched on that you might be taking. And CBN can, make your cannabis as well as your pharmaceuticals more effective without making them more dangerous. So you can actually, use CBN to start to reduce how much that you take, even before you find out, what other cannabis products can help replace them.
Right. And classically, when you put THC and CBD together, it's almost like 1 and 1 is 3. And I say that because you'll notice that here's Delta 8 that, for example, helps relieve pain. And then you also have over here, you have CBGA, which helps reduce pain and inflammation. They work together. Again, it is something where they work in partnership. It's not a matter of just using CBD or just using THC. In many cases, especially in the case of pain, it's really by using the combination, it's a lot more effective. And then that's where you adjust how much CBD and how much THC you take. That's the ratios. They talk about the different ratios that you use. So let's talk about some of the you were touching on some of these a moment ago, Alex. And so this may be redundant, but there are a couple of them that are really key. And this is, as we've learned more about cannabis the last 5 or 6 years, really a lot of these have been highlighted. And when I got involved in the business, it was a THC, CBD only kind of world. But you want to chat about some of these?
Yeah, definitely. So just building on, what I kind of went over before, maybe a little bit preemptively, going a little bit more in depth into some of these other lesser known cannabinoids, other than THC and CBD. So for CBG, it's also great for pain, nausea, inflammation, and as we all know, inflammation can cause a lot of issues as well as make a lot of issues worse. And there's multiple things in cannabis that we've seen already that can fight inflammation, right? So this is kind of all tying into something that we're going to touch on later, known as the entourage effect. But really, the take home is that cannabis is, one plant. You can have one product, but it's going to contain many different medicinal compounds. And like Mark already touched on, that's, can help each other work better. They work in a synergistic fashion. And as well as the CBN, it's also anti-inflammatory in and of itself, antibacterial, and like I mentioned, helps with sleep. The THCV is also known to help stimulate bone growth. And then you've got CBC, which is also a lesser known one that's also an anti-inflammatory.
Right. So what's interesting is when I got into the business about 7 years ago, there's a lot of talk about sativa and indica. Tell me a little bit about those and how that relates to the CBD and THC.
Yeah, so the sativa and indica uh, strain varieties are going to be at the end of each spectrum. Okay, so there's a difference in their structure. Typically, as you can see by the photos here, the sativas are going to be taller in stature, narrower leaves, longer flowering cycles, and they also typically produce a lot more flower. Whereas your indica varieties, those are going to be shorter in stature, have fatter leaves, be way closer to the ground, obviously, shorter flowering cycles, and a little bit better for colder climates. Okay. Now, we classify our products under indica, sativa, and hybrid, which is going to be a cross of the two and somewhere in the middle. We classify them more so on the effects that they give. Okay. So, and you can always remember which is which, because indica puts you into couch. Okay, so your sativas are going to be at the other end of the spectrum. Okay, so the indica strains better suited for nighttime use. They're a little bit better for sleep, and the sativas are more stimulating, a little bit better for daytime use. Okay, and the differences in those effects is really coming from what we briefly touched on, which is the terpenes. Okay, so the terpenes really drive those effects of the cannabinoids.
Yeah, I think over the last 5 or 6 years, there's been a lot of research into medical cannabis. They've obviously discovered a lot of these different components that you saw the slide before. There's actually quite a few more. But by understanding those components, what they're able to do is they're able to accentuate and be able to produce products that actually address things like sleep, things like pain, those type of things. They understand why they work, how they work, and be able to produce what they call strains or products that be able to address those particular situations. And of course, cannabis produces terpenes. And so those terpenes actually, we'll explain how they work in just a second. The terpenes actually help drive and really bring home the effect of cannabis for what you want to do. It's important to point out, though, I'm going to go back to it. Your body is different from every other body that's out there. Again, I use the alcohol scenario. Some people can consume a lot and some people can't. Go low and go slow with medical cannabis. That way you can decide, you can find out what works, what doesn't work. You can help go up from there. But it's something that helps you as people are putting together, and these dispensaries like Trulieve are putting together these products that address your situation. You'll be able to actually dial in what you need to be able to help you. And terpenes are a big way of doing that. I mean, the endocannabinoid system is the highway. Amandinoids are kind of the drivers that push it through. Cannabinoids are the CBD and THC, but terpenes really is what cause and trigger the effects that are there. You want to explain that, Alex?
Yeah, without a doubt. So I know this might seem, like brand new information to you guys, but you're actually already pretty familiar with terpenes. Terpenes are in plants, every, plant, animal, fruit, vegetable, flower that produces a scent, has a flavor. So if you smell pine, you're smelling alpha pinene. If you smell lavender, you're smelling linalool. Okay. And if you're familiar with aromatherapy, you know, something like lavender or linalool is going to be more relaxing, right? Where something like, you know, a pine scent or a citrus scent is a little bit more stimulating and invigorating, right? So it's going to be the same when it comes to the sativa and indica strains. So you're more likely to find, you know, linalool in a indica strain as it's relaxing, right? Could help you sleep. And you're more likely to find things like limonene or alpha pinene, which are more stimulating. You're more likely to find those in sativa strains. Okay, so it all sort of, you know, works together and kind of lines up. So if you've, you know, caryophyllene is another very prominent one, along with humulene, which is in hops. And one that's very important as well in terms of effects is going to be myrcene. You'll see that one down at the bottom next to the linalool, and that's found in mangoes. Now, why this is so important is that the myrcene content is going to be the main dictator of those indica versus sativa effects. So if you have a myrcene content over 0.5%, it's going to be more prominently indica in the effects. If you have it under that 0.5%, it's going to be predominantly sativa effects that you should experience from it. Now, again, everyone's a little bit different, and the other terpenes do play a role, especially if you're, say, more or less sensitive to, you know, one or the other. But in a nutshell, that's kind of terpenes for you.
Yeah, I mean, terpenes are very, very important. They help drive the bus. I will give you my story where when I got into medical cannabis, it was because I had an auto accident. It left me with 7 herniated discs in my neck and 2 in my back, and that's no fun. Was prescribed medication, Percocet and other things by the doctors, but I just couldn't work. I mean, it was something where I couldn't be able to function as a human being taking those drugs, especially at the quantities they wanted me to take them. So I got into medical cannabis, and when I went into the dispensary for the first time, and the medical marijuana doctor given a recommendation, and I went in and talked to them. They said, "Here's the products you should use," and I was new to it, so I took them home and tried them, and of course some of them worked, and I had to adjust the other ones. And I went back like 3 weeks later and talked to them about how it was working, my experience, and they recommended we make some changes, which I did. I'm talking about the dispensary and the products that they were using to make sure it addressed my situation. And I got bold enough to ask, how do you know what works and what doesn't work? When I walk into this dispensary, I see literally multiple products on the shelf. How do you know which one I should be using and not? And the bud tender said it's very simple. I look at the recommendation made by the doctor. More importantly, I listen to you as to what your situation is, what you need. And then I match it to a terpene profile and a strain that addresses your situation. And the light bulb went on for me. This is very much like when I go to the doctor and I describe my situation and he says, "Here's what you should take." There are different types and different strains of cannabis that can be able to help us with different situations. And especially lately, there's been a lot of research into those products. And we're getting better at making medical cannabis that targets and helps particular things. But a lot of it has to do with, as Alex mentioned, the terpene profile tied to the hybrid cannabis is something to get you there. Now, there's a couple of these that are what I call the top 5, and you touched on them earlier. But I think there's some, like we should point out, like pinene. Pinene is really good for memory, which is fantastic. However, if you have PTS, I don't recommend anything with pinene because you really don't want to bring back a lot of those memory features. What's your thoughts? Alex?
Yeah, absolutely. You know, and just like you have to pay attention to, you know, your THC, as that's a stimulant as well. If you're suffering from PTS or anxiety or other forms of panic, you know, terpenes are very, very important as well. We do have products that don't have terpenes in them, but most of them are going to, and they will have an effect on you. So you have to consider all these different factors, right? When you're, you know, kind of making your way through this new type of medicine. And also want to point out that, you know, these terpenes in and of themselves are, you know, individually medically beneficial, you know. So it just goes to show you how many other different forms of medicine that, you're getting in just one cannabis product. I mean, it's you know,
It's
really,
interesting. Yeah,
yeah.
it's fascinating. And Barry White, notice down here, caryophyllene, that's really good and is really known to really help with stress. Okay, that's something that's out there, both pain,
Right.
anxiety, as
And
well
that
as
is something too, just to touch on the caryophyllene, since it's, found in black pepper. That is another trick that I have heard, that if you consume some black pepper or chew on some black peppercorns, that can also help mitigate some THC euphoria as well. So if just one more tool in your toolbox there, along with the CBD, in case you do ever find yourself a little bit over medicated.
Sure, sure. Let's talk about strains. I think one of the questions is there's been a lot of strains that have been put together to really address stress, anxiety, and stress. Why don't you talk about a few of these?
Yeah, without a doubt. So all of these strains are going to be ones that we carry in many different forms and products. And they're also very well-known strains. So it can take some time to adjust to some of these names. I do understand they're a little bit off the walls, but sometimes they're named after, say, the grower that's kind of created the strain. Sometimes they're named after the scent or aroma. Sometimes they're named after the effect. There's a strain called blue cheese. It's supposed to smell just like blue cheese usually. And we have a strain that's not on this list though. That's also one of our more popular ones, known as 9-Pound Hammer. If you can guess, that's an indica strain because it's named after a 9-pound hammer, because after you use it, it's going to knock you out. It's going to make you go to sleep. So just going down the list here, Girl Scout cookies, that's going to be a very popular hybrid. Okay. And it's actually a cross of another hybrid on the bottom of the list, OG Kush. Okay. And so this one's going to have a lot of popularity in the medical community. I'd say it's just well known for its benefits for pain. It's awesome for pain as well as anxiety, as it's not a full sativa leaning strain. So moving down the list there, we've got Granddaddy Purple. This one for me, it's a really nice indica strain that has a really nice fruity flavor that doesn't necessarily knock me out and put me to sleep. It's one of the few indicas that doesn't affect me so, I guess, so strong. And then down the list, we have Jack Herrera. That's going to be a sativa dominant hybrid. We classify it as a sativa. It's going to have a nice orange lemon pine scent, and it's got really nice balance between relaxation and kind of the cerebral stimulation as well. Now, again, kind of going back to the start low and go slow in terms of CBD ratios and graduating to THC. Same things apply to the strains, especially if you're treating something like panic or anxiety or stress disorders. Start with the indica strains, since those are more relaxing. They're going to be less likely to say cause anxiety or a panic episode. So just always keep that in mind. Sour Diesel is another popular sativa strain. It's named after the scent. It's going to have a piney kind of chemical, cleaner, sour type smell to it. Some people love it, some people don't. And that sometimes can kind of give you a hint if you're going to, like the product or not, is if you can, smell the terpene profile. And if you think it smells nice, typically I've seen that the patients do enjoy the effects of those products that they think smell good. Moving on down the list, we've got Blue Dream. It's going to be a sativa dominant hybrid. Again, very, very popular for pretty much everything across the board. It's a pretty even keel hybrid, similar to Girl Scout cookies, so it can help with depression, anxiety, pain, insomnia, and even help with concentration. So it can kind of just do it all. And then we already touched on OG Kush previously, but great for stress, anxiety, and depressions. And it's going to be one of those old school staples.
Sure. Let's talk about dosing forms, how people take products for a second. I know that at least when I got in the business, again, 7 years ago, I didn't exactly perceive that people would be sitting on the front porch smoking a joint. And in fact, the cannabis industry has come a long way, an awful long way, especially the last 5 years, 10 years. there's a number of different ways of actually taking it. And that goes a lot towards how it affects you and how you can help your body. And I do want to point out this slide, the top part here, these are new edibles that are out on the market. And these are really something that was introduced towards the end of last year, right? Right, Alex?
Yes, indeed. The edibles are the newest change to the Florida medical market. Hasn't even been, 6 months yet since these have been out. And we did kind of come out right out of the gates with as many options as possible. So we do have gummies available. We have chocolates, we have cookies, we have brownies, all sorts of things. And also on the top there, we also have lozenges. So they're sort of like cough drops. We have different flavors, but those are great as well, kind of fall in the same category. And yeah, there's so many different products. There's there's definitely going to be something for everyone. So and one important thing, I know it can be overwhelming with different dispensaries, different products and things. Just always keep in the front of your mind that Trulieve has the most amazing return policy in the entire world, as far as I know, when it comes to cannabis. So we do have a no questions asked 100% return policy. So if any product that you take doesn't work, doesn't give you the desired effects, even if you use half of it, 3/4 of it, all of it, or if something, breaks, like a, vaporizer pin device, please always bring it back and give us the chance to swap it out for something that will hopefully work for you, and of course free of charge. We don't want to put the financial burden on you guys for having to find out what works and what doesn't, because there's just not a lot of research and data out there, and all we can really kind of reiterate is to start low and go slow.
Yeah. And this is something I think is a real advantage of Trulieve. You will exchange products, and it eases the financial burden of being able to try something. If it's not working for you, take it back and exchange it for something that does. That's important. I think you're the only dispensary that does that here in Florida.
On the 100% level, as far as I know, we're the only dispensary that does that in the entire country or world. Some other dispensaries do take certain things back given certain situations, but a lot of them are, all sales are final. So that's why we're just fantastic for new patients.
And especially as a medical patient that's going low and going slower, even after you've been using it, like I've used products for 3 or 4 years, gives me a chance of trying some things. And if they work, great. And if not, I can just go back and exchange them.
Exactly.
Yeah. Now let's talk about dosing. This is really important. The dosing, how do you take it? How does it affect? How does it affect you? Why don't you walk us through this? Because this is really critical to being able to effectively use medical cannabis.
Yeah, without a doubt. So there are 5 different routes approved by the state of Florida to consume medical cannabis. This definitely encapsulates most of them over here on the left. So it's important to point out that they are going to have different durations and onsets in terms of the way that you're consuming it. So if you're using something that you would ingest, like a edible or a capsule, that's going to be more like a long-lasting type of medicine that's going to give you about 5 to 8 hours of relief, but it can take 30 minutes or up to 2 hours just to kick in. So for more of a breakthrough type of cannabis medicine, that's where you'd lean towards something that you would inhale, like a vaporizer device, or whole flower perhaps. Or you can also get faster onsets by using sublingual products and allowing them to absorb under your tongue. If you let the products absorb under your tongue, then it can get right into the bloodstream, and it takes effect a lot faster that way. So if you're not quite comfortable with the inhalation routes as a new patient, then that would be where you'd want to start for like a breakthrough type medicine for whatever you're looking to treat.
Yeah, and capsules, for example, are a very effective way. Now, understand it goes into your system. Your stomach acids will absorb about 20% of the capsule itself, but they take a little bit longer to work, but they work longer.
Exactly.
Right. So you want to address that?
Yeah, without a doubt. So, like we said with the edibles, we had the note to be careful with them. That's why, because, they can take up to 2 hours to take effect. And also, since they are metabolized differently. Your liver actually converts the THC to a different form. Won't go into it to try to confuse you, but the takeaway is that it's going to be a lot more efficient at binding to receptors, which makes it feel a lot stronger. So that's why you want to be extra careful, to be patient and wait 2 hours at least before you would want to double up on an edible or a capsule type of product.
Right. And you mentioned working right away. I mean, you have products, for example, like the vape pens or the topicals. I want to address something if I can for a second. You can use multiple forms of dosing. In fact, it's recommended that you use different forms of dosing to address your particular situation. In my case, when I wake up in the morning, because of the herniated discs in my neck, I have a high level of pain. Probably on a scale from 0 to 10, it's sometimes a 7 and an 8. So I want to take a sublingual drop to be able to address that. And so I do. Literally, when I wake up in the morning on my nightstand, I have sublingual drops and I take them. But I know it's going to take, in my case, about 20 to 25 minutes for those drops to work. And I really don't want to run around for a while with a high level of pain. So right next to my drops is my vape pen. And I'll pull a vape pen out and I'll take 1 or 2 hits of the vape pen, and almost immediately it works. In fact, within the next minute or two, the pain level will go from a level of 7 down to a level of 1. And I have to tell you, the first time that happened, I looked at my wife and said, "This is crazy. This is like, you've got to be kidding me." And even when I did it, like again this morning, I'm just amazed at how fast it works. It really is something that addresses the pain.
Yeah,
I had a
absolutely.
heavy workout, for example, last night. I came home from that workout and my left knee was killing me. I grabbed one of the vape pens from Trulieve, and Delta 8 pen, the 1-to-1-to-1, and my literally within 3 minutes my pain level is gone. And I think that's important to just mix and match the things that are out there.
Yeah, without a doubt. And there's also different options as well. Kind of like, we mentioned how the sublinguals can be a, inhalation alternative for breakthrough medicine. There's also sprays. For instance, Trulieve does carry a nasal spray. It was designed as a seizure rescue spray, but it's also shown to have a lot of benefits for migraines as well. And then we do have topicals, like Marc mentioned, that start working almost immediately. So another type of instant kind of breakthrough medicine, just not one that's going to, obviously penetrate and be as effective as an ingestible or as an inhalation product. And I also do want to point out with the flower, I know that the state, classifies this as smokable flower, but it is just access to whole flower. So you don't have to smoke flower. There are other ways to use it. A lot of patients cook with it. A lot of patients make their own, tinctures or extracts. I've even heard of people that steep it in hot water and kind of make like a tea out of it, which pulls some of the THCA out of the flower, which isn't psychoactive. So there's also vaporizing devices if you just don't want the combustion aspect, but still want the breakthrough inhalation route. So there's just a lot of different ways to use that whole flower.
Yeah, in fact, I found it interesting when I first got involved in this. I found on YouTube there was a lady. Her name was no, she's a Italian grandma. I'm Italian, and she started cooking with flour in order to help her friends. She didn't use medical cannabis, but her friends needed to be able to take it, so she would produce meals with them that had medical cannabis in it. And she has a whole recipe source out on the internet on YouTube. It is something that, yes, you can't smoke it, but it also is used for a lot of other things. And then you have concentrated forms of flour, the crumble and the shatter, right?
Yes, sir. We have crumble shatter as well as what's known as rosin, which is a solventless concentration. But all of those mentioned, those are going to have the same entourage effect that you would get with flour. And in that, I mean that's they're not distilled down to just one cannabinoid like a THC concentrate. It's going to be a whole plant concentrate and be full spectrum.
Yeah. Now a lot of people, especially when you're first getting into medical cannabis, they're not looking at like crumble shatter, that type of thing. If you've been in it for a while, you'll find it's just a way of, for example, in the evening, being able to dial in the products that you need to help you sleep and do things like that. But
Yeah, exactly.
there's a broad range of products that are out there. Alex, I want to take a moment. We're getting some questions, and I think it's important that we address at least some of the questions that we have out there. One of the questions is, if I add a CBD only to my daily routine to reduce stress, is taking it every morning sufficient, or is it every few hours for the right dosage? What's your thoughts on that?
That's a great question. I do know that CBD has a shorter half-life than THC. So especially if you're just starting out, I think taking it, 2 or 3 times a day can show some benefits. But, again, that's where we go back to, keeping track of, what you're taking, how much you're taking, and the effects that you're getting. So you can, maybe just try once a day and then for a couple of days and see how you feel, and maybe try to divvy that dose in half and take it twice a day, or maybe take the same dose twice a day. Just keep track of the effects, and that's where you're going to dial in your medicine and find your sweet spot, as Mark likes to say.
Right, right. I think there's another slide we should probably go over and then answer a lot of the questions, because this will help quite a bit. We've talked about dosing. We've talked about getting it right. I can tell you, if you'll just have some patience, get into the medical cannabis business, get in using medical cannabis, go low and go slow. You'll try it initially. It may or may not work for you. That's where you need to adjust either the amount that you're taking, the times that you're taking it, or whether you take it in the ratios, how much CBD to THC. There's ways of adjusting. Your body will tell you exactly what works. But classically, in my case, it took about 2 weeks and I was able to dial it in. And I can tell you, when you have a pain level of 7 and I can take it down to a 1, and I've been able to keep it that way for 4 years, it's worth it. And in many cases, I know there are people like that have anxiety and stress. They've been able to take this, and their anxiety and stress goes down. I have one person who told me, I've been living under this cloud for almost all my life. And when I started using, especially the CBD products, it was almost like a cloud listed. I realized that all these what it was like to be one of these happy people. I was able to really enjoy life a lot better. And again, it took her a week or two to get her formula right, but it was worth doing it. Why don't you talk about how you find your sweet spot, Alex?
Yeah, without a doubt. So obviously, already kind of touched on the journaling aspect of finding your sweet spots. But just to go over some terms real quick as well, want to really point out microdosing. So that's the idea of microdosing, is taking such a small amount that you might not even notice the effects whatsoever, but you still get the benefits. And we do have certain products that have improved absorption that we'll go into later that can help you microdose and take really small amounts of both THC and CBD and still receive benefit from it. And also, if you hear the word titration, that's just referring to your dose and how much you're taking. So the start low and go slow is, kind of designed around titrating up on your doses of CBD to see if, you can resolve your issues with just CBD, and then incorporating THC after that. So just to cover those real quick, and journaling, again, can't hammer that home enough, as far as, when you're taking it, the amount that you're taking, what you had in your stomach at the time that you took it, whether, you had food or you didn't have food. Do keep in mind that, THC is fat soluble, cannabinoids are fat soluble. So, whether you have an empty stomach or not, can really, kind of change the effects, the onset, the duration and things, what other medicines that you're taking at the same time. And then obviously the effect that, you receive on your symptoms from the medicine, as well as the onset time, and then any change between different doses of the same product. So all those things are very important to keep track of. If you're more experienced, you can probably feel your way through it a little bit better. But if you're new, definitely recommend journaling as detailed as possible.
Right. And this is where your dispensary will help you figure out the right amount. Your medical marijuana doctor will help you figure out what it is, how much CBD to THC, the ratios, and of course, when you take it. You'd mentioned taking it as a daily routine. In my case, I'll talk about regimes for a second. I have to address the inflammation in my body. I had a knee operation, artificial knee put in a couple of years ago, and it causes inflammation. And then the herniated discs, what causes a lot of that pain is again from the inflammation. So in one case, I have to address inflammation in my body, and if I can keep my inflammation down, I can keep my pain level down. On the other side of the coin, I do have to address the pain because it's there, and CBD will only go so far with the inflammation to relieve it. But I do have to have a certain amount of THC, and this is where you learn how to dial it in, what works and what doesn't work. And again, go low and go slow. Again, I pour just like alcohol. You know, you don't start by pouring yourself a glass of vodka and drinking the whole thing. What you want to do is you want to try a little bit. You want to mix it with certain things. You want to try it with CBD and THC ratios, high with high CBD, low THC, to be able to figure out what works. And your body will tell you exactly what works and how it works.
Without a
So
doubt.
let's try another question. A question that comes in from Gloria. She says, "I have panic attacks. I do not know what brings them on, but when I experience them, I feel like I cannot come out of it, and it gets worse. What do you suggest?"
That's a great question. So until you're familiar with how you're going to react or the effects that THC will have on you, definitely start with CBD since it is known to help with anxiety. So you can try high amounts of CBD because remember it's not going to have any psychoactive effects. Okay, so it's not like you could take too much CBD. So I would try that, and if you can get it in a fast acting form, like a sublingual form or a vaporizer, potentially if you're comfortable with that, that would definitely be the place to start. And if you are familiar with THC, then if you want to incorporate some, then try something that's going to be a indica-based strain to make sure that you have more relaxing effects and don't get any stimulating effects.
Sure. What you want to do is you want to be able to, if you have the panic attack, again, I'm just going to use as an example, you could use it, grab a vape pen, again, a high THC, high CBD, or a one-to-one kind of vape pen, and see how that works. A vape pen will work almost immediately, and you'll be able to just relax a little bit. You should be able to see how it affects. Again, every person's body is different, but when you ask, what do you recommend, or you suggest, the suggestion would be, I'd suggest a one-to-one vape pen to start with, and or a one-to-one tincture. Is that safe to say?
Right. Yep, I would recommend getting some CBD in some fashion. So definitely a ratio product and whatever form that you're comfortable with, but definitely want some CBD in there.
Yeah. One of the questions that comes up is should again it was brought in by Elisa. Should edibles be taken before or after eating?
So that's a great question. And as far as how it's going to, I guess, be preferred by you, you would kind of want to just try both. I would see if, because sometimes if you have food in your stomach, it might take longer to take effect. Okay, so if you're taking these edibles and you'd like them to kick in sooner rather than later, maybe you ideally want to have less food in your stomach or none at all. So it's kind of just going to depend on, I guess, your specific sort of situation.
Yeah. One of the questions that was brought up, and it's kind of a longer question, and we may have answered that with the slides, but I'll read it so we can get it answered for Lloyd. Sure. It says a related question. He's been researching capsules for sleep instead of tinctures. He's read that indica tinctures are effective and have a time of 4 to 6 hours, and they become effective after 15 to 20 minutes, whereas indica capsules are 1 to 2 hours and become effective in 6 to 8 hours. His question is does 6 to 8 hours of effectiveness start when you take it or when it kicks in? Where do you count it?
Well, I would count when you start to notice the effects. I suppose either reduced of a certain symptom or when you feel the THC. Now, just again, though, everyone's going to be different and every day is going to be a little bit different, like when you take it. So, just like we just touched on having, eaten or not, can play a role, how fast you're wanting it to kind of kick in. So, it's still going to vary. And then as time goes on too, as you develop a tolerance or get less sensitive, you'll also notice that that can change a bit. You know, it might take a little bit longer for you to feel it, and it might last, you know, less time as well. So there's a lot of factors that kind of go into that.
Yeah, there's one question that came. It's a very good. This is one question that came in. It's a good question. It says, "I've been taking depression meds, sleep meds, and anxiety for 25 years. Can medical marijuana be a better solution for treating this combination? And would it be something that could replace my current meds?" And that's brought to you by Robin.
Yeah, Robin, great question there. You know, unfortunately, there just is a lot of variability, right? So there's no definitive answers that we can really give you for, you know, some of these questions. But as far as you know, what I've seen, you know, I've seen countless individuals get off of those types of medications partially and or completely. So I would say there's definitely benefits to be had using these products to, you know, try to replace you know, some if not all of what you're taking. So I would definitely recommend you know, exploring this alternative.
Yeah, it's something definitely worth looking at. And also, the pharma meds aren't necessarily good for your body, where cannabis is. It's your own body helping heal itself. So I think you'll find that probably from the standpoint of your overall health, medical cannabis can help. But again, you have to listen to your body, make sure you get it right. And if you follow the whole the regime, the journaling, and listening to your body, and working again with your pharmacy, your dispensary, as well as your doctor, you have a good chance of being able to get off the meds. I'm not saying this for sure, but I don't know your medical condition, but there's a good chance that could happen.
Yeah, without a doubt, and also just for longevity purposes too. You know, cannabis is a neuroprotectant. You know, so it's very beneficial, even if, you know, kind of used as like a daily supplement. But yeah, you definitely want to explore some medical cannabis options, Robin.
Yeah, one of the questions that comes up is it beneficial to combine hemp flower? I suspect they mean CBD with high THC marijuana. Okay, and does Trulieve carry a 1-to-1 CBD flower?
That's a great question. And the answer to the latter part is yes, we do carry a 1-to-1 flower. It's Harlequin GDP is the strain. And we actually had some in the other day when I was poking around the website. I did see some on the website. And as far as, you know, should or can it be beneficial to add the hemp flower or CBD flower? I think it's always going to be beneficial to incorporate additional CBD into your regimen, you know, wherever you can, and if it's cost effective. So, you know, if it's readily available, I would say sure, as long as it's, you know, I guess a positive experience for you. I know sometimes hemp flowers I've heard can be, you know, a little bit drier depending on where you get them, you know, maybe a little bit harsher, you know, of an experience. But, you know, I'd always say that, you know, incorporating more CBD is going to be a good thing.
Yeah, I know that, and it sounds kind of crazy, but I had a total knee replacement a little over about 2 years ago. And of course, there's the rule that says THC for pain, CBD for inflammation, use them in combination. I worked with my doctor at Jewett Orthopedic, and we actually worked with him and my medical marijuana doctor to come up with a regime post-surgically, so that right after the surgery, I would use medical cannabis instead of pharma drugs. And I was the actual experiment for Jewett in how to do that. And of course, we didn't really know if it would work or not, and I had the Percocets available if I needed them. And I don't know if any of you had a knee operation, but they're no picnic, that's for sure. What was fascinating was I was able to get literally when I left the hospital, I was operated on Monday, and Wednesday when I left the hospital, I didn't take any Percocet. Literally went into the parking lot and took some tincture drops, put them under my tongue, and hit the vape pen. And by the time we got from the parking lot, from the garage to the street, my pain level was down to a 1 from an 8. Okay, been the lowest pain level since since the operation, and it stayed that way. I was able to pretty much keep it that way as long as I followed my regime. Again, I had to follow my regime. If I forgot to do something, then of course it would let me know that's what I should do. But what was fascinating was when I had pain, I had this concept of taking more THC. And one time I was running low. In fact, I ran out of a product that had the THC in it. So I took a little more CBD, and guess what happened? My pain level went down. And when I went back and I talked to my doctor about it, he said it's real simple. What you're fighting is inflammation. The inflammation in your knee is what's causing your pain. If you can reduce that inflammation, your pain level goes down. And a light bulb went on. If I can know what the problem is, if I can address the cause, I can address the pain. So I've been incorporating a lot more CBD in my regime ever since then, and it's been it really been more effective in keeping my pain level down. I can't emphasize. Yes, you want THC for pain, and THC is critical in working and solving a lot of issues. But CBD also has tremendous benefits in addressing, again, the inflammation side, and also being able to allow your mood and your mood and your stress orientations.
Yeah, without a doubt. Yeah, CBD is very significant and important, even though it doesn't have psychoactive effects.
Right,
So always remember that.
right. Um, let's take maybe one more. I think I want to save a few of these questions when we get into your products. So I think it'll be better to be able to answer some of those. Because I have a lot of questions related to that. I do want to do one thing before we jump into Trulieve. We're doing a study. I'm working with FAU, and what we'd like to do is we'd like to have you contact. And by the way, after this webinar, you will get a email. It'll have a copy of the video. It'll have a copy of the slides. It'll give you resource information, and it'll also give you this link to this particular study. Please fill out the study, whether you're using medical cannabis or not. We'd like to have you be able to fill this out. It's a study to be able to study the pain in seniors, and it's something that, again, we'd like to be able to get more information. It's a kind of a plug for it, but we can help ourselves here in Florida, especially with pain, especially for senior citizens. And if you could do that, that would be very, very nice. But let's talk about Trulieve for a second, Alex. Who are you?
Yeah, let's get into that. I guess I can brag for a little bit here. So Trulieve was the first dispensary in Florida, and we're also the largest, with over 70 locations now open in Florida. We look at ourselves as an industry leader. We're typically responsible for a little over half the total dispensations of medical cannabis in the state each week, and we're very proud of that. Accessibility and patient access is is our first priority. And I did go over the locations. That is an outdated slide there, so sorry about that. And we do think that we're the best. We stand behind our products like nobody else, with the best return policy in the state, maybe the country, and maybe even the world. Like I said, I've never been anywhere else where I can take cannabis products back, especially every single thing that a dispensary would carry. We also look at ourselves as very innovative. We've got the most cutting edge equipment. You know, we're constantly expanding our production space and our grow spaces to be able to bring more products and more availability to our stores. And we're very proud of, you know, the part that we play in local communities around the state. You know, we like to partner up and support, you know, local beneficial community organizations, you know, that are, you know, doing great things for, you know, people that need help. And we want to support that because that's what we're here to do.
And we appreciate your sponsorship, by the way. Help you quite a bit. Let's talk about a little bit about your nanotechnology, because this is really key. You talked earlier about some of the nanoprimitive products that work quicker and you can use less of them. Why don't you explain this?
Absolutely, guys. So kind of piggybacking off of the microdosing concept there, we do have what's known as our true nano technology. So basically, we use a process known as sonification, where we use sound to make the cannabis molecules as small as possible. This allows it to be absorbed a lot more easily and efficiently, and it brings the bioavailability and absorption over 90% for the cannabinoids in these products. So that's going to be 3 to 4 times what it is typically. So it's going to act almost like a water soluble molecule. So it's easy to dissolve. Whereas, you know, THC is typically, you know, known as an oil, which, you know, isn't going to dissolve in water, but the nanotechnology does, We have it in a powder form as well as a tincture form, and as well as in the true tincture drops, which are the cough drops or lozenges that I mentioned earlier. So each are going to be, different prices, have different options. So for instance, the tincture, we do have a high THC and a high CBD ratio. So the 1:8 is going to be the high THC, and the 8:1 is the high CBD. And they're very affordable, just $55 per tincture there. And, given the nanotechnology, it should last a lot longer than a typical tincture would. Also, we have a powder form of the true nanotechnology. Now, this is very versatile, especially for new patients that are looking to incorporate THC into their medical cannabis regimen. And the reason why is because, it can act as, a breakthrough medicine if you mix the powder in a small amount of liquid that you can hold in your mouth at one time, and you can swish it for about 60 seconds, and then you can swallow it back. So when you swish it, it allows it to absorb in the capillaries and whatnot under your tongue and hit the bloodstream a lot faster. Now, if you're new to cannabis and you're just starting to incorporate it, you can also take that same, dose. Each scoop is just 5 milligrams. Okay, so not an outrageous dose. And you can mix it in a, larger amount of liquid, like your morning coffee, or, a smoothie, or a tall glass of, tea or juice. And you can drink it down over time, and it's not gonna hit you as quickly. So then it's going to be more so, subtle in its onset, and likely last a little bit longer as well.
Yeah, and the true powder I mentioned on that, you mentioned swishing it in your mouth. I use it with smoothies. I think it works great for that.
Yeah, it's very popular. We do have different flavors as well. We have a vanilla cream option, which would be great for, sweet things like a smoothie or in your coffee. And we also have a lemon one as well.
Yeah, there you go. Let's talk about your ratioed products.
Yeah, so the ratios do kind of envelop the nano right from the last slide. So that's why there's a picture of it on here. But we do have ratio products in nearly every category. We even have a 1:1 sunscreen if you're looking for a ratio topical option, which we're going to be doing a lot more expansion in our topical line upcoming here in February, from what I hear. Now we have True Flower 1:1 that I've already talked about, the Harlequin GDP strain. But one thing that we're going to talk about on this slide and a few other ones, or at least one other one, is going to be our True Clear. Okay, so that's going to be the picture all the way to the right there, where it looks like the nice purified liquid. So that's what's known as distillate. Okay, so that's going to be pure THC oil or pure CBD oil with reintroduced terpenes. Okay, so those are the only ingredients that are going to be in there. It's a very concentrated product. And so each little syringe, the amount that you're seeing there is going to be 1 gram, and it's going to typically contain anywhere from 700 to 900 milligrams of active cannabinoids, so THC or CBD in there. And we do have that with different ratios, not just 1:1. We have some with some Delta 8, but we'll go into that later.
Yeah.
We also have
Go ahead.
ratio capsules. Now we do contain or have RSO oil in that in our capsules that are 1:1. If you're familiar with RSO oil, it's just a full spectrum whole plant type of extract that's going to be have a lot more additional benefits than, say, what the True Clear would have in terms of different cannabinoids in that product. And then we obviously have the tinctures like we've gone over. We have just a standard 1:1 tincture that's not nanotechnology. So if you're looking for something that's not gonna I guess have as high of a absorption or bioavailability rate, if you're very sensitive, start with the non-nano tincture. And then we've already gone over the nano ones. And then of course we have ratio options in our vaporizer cartridges as well.
Yeah, and I should point out probably the best way to start is right here with this tincture 1:1. That's usually the starting point that most people start off with. And with being able to try to 1:1, you'll find out how sensitive you are to CBD. You'll find out how sensitive you are to THC. You'll find out what it does for your body. And then what you're able to do is you're able to maybe, for example, try an 8:1, 8 CBD to 1 THC, and vice versa. In other words, what you're really trying to do is you're trying to dial in what works for your body. And it's not just the product itself, it's how much you take, whether it's 25 milliliters or 50 milliliters. You can also dial that in as well.
Hmm. Exactly.
So let's talk a little bit about the Delta 8 products. This is one of my favorites. Go ahead, Alex.
Yeah, I know it's one of your favorites, Mark. It's one of mine too. And the reason being is just because it's going to be, so much lighter on the euphoric end that it's great for daytime use for a lot of people. So, as I mentioned, we have it in the True Clear option, which is going to be a little syringe there, and then we also have it in a vape cartridge, which we call our true pods. Okay. And we have that in a few different ratios. Okay. So we have it in a 1-to-1 with just Delta 8 THC and CBD. So that one's going to be milder than a traditional 1-to-1 ratio. Okay. Because the Delta 8 is, milder than traditional THC, and it's still got the anti-psychoactive component of the CBD in there as well. We have it at a 1-to-1 with Delta 8 and Delta 9. So it's going to be weaker than just a full strength THC product. And then we have it at a 1-to-1-to-1. I think that one is going to be Mark's favorite. That gets into his sweet spot, but that's going to have 1 part Delta 8, 1 part Delta 9, and 1 part CBD. So still going to be a little bit weaker than, say, a traditional 1-to-1 vape because you have the Delta 8 in there. But with the Delta 9, it's going to pack a little bit more punch than the one that just has Delta 8 and CBD, especially for pain.
Yeah, I love the 1-to-1-to-1 because in my case, I'm trying to address my inflammation to really get the inflammation down. I'm also trying to address the pain because it's there. And then the CBD helps overall to make sure it regulates it and I'm just not getting high. It's the best way of putting it. So
Exactly.
Very effective product.
Yep. So if you're looking to, kind of, be a newbie in this medical cannabis area, and you're, new to the effects of THC, obviously ratio products containing Delta 8 are going to be a great place to start.
Now I'll tell you my opinion, and this is only my opinion. I found the 1-to-1-to-1 works better than Percocet for pain, as far as being able to get rid of my pain. If you gave me a choice of which of the two to take, I'd definitely go in that direction from an effectiveness standpoint. And I've heard that from a lot of people, that it's the same kind of thing. Some of the people I work with and I work around will say the same thing. It's something that if you live with pain, it's something you should pay attention to this better than anything that I've ever run into.
Couldn't agree more.
Yeah. Let's talk about lab testing. Oh, let me back up for a second. We have a question. Is Delta 8 a synthetic?
Great question. And no, it is not. It is comes from the cannabis plant. It can be converted from either CBD or THC. So it is not just made in a lab.
Right. There you go. So let's talk about the certificate of analysis. One of the problems that people have is, how do you know you have a quality product? How come I make sure I'm not getting junk? We've all heard about the stories of people buying stuff off the street and getting sick and are dying, like in the case of the vape pens that were unregulated about a year and a half ago.
Right.
Here in Florida, with very tight regulation with respect to quality of products, why don't you explain that, and also what certificate of analysis are?
Yeah, without a doubt. So, kind of like we touched on earlier, this is one of the, huge benefits of, being, certified for this program is, you have peace of mind and transparency, at least with all of Trulieve's products. So, from the get-go, we've always done third-party lab testing for all of our products. We do that through American Clinical Solutions. We've been with them since the get-go. We also have our own independent labs, but obviously for a transparency factor, the third party is much better. Now, this is just one page of our certificate of analysis, or COAs, as we call them by short. So this is kind of showing you that it passed all the different tests for anything from, residual solvents, moisture, terpenes, mycotoxins, potency, pesticides, things like that. So if it doesn't pass all the tests, then obviously we don't shelf the product for sale. But these are going to be really important, not just, so you know what you're getting, but in terms of your journaling and, finding your sweet spot when you compare strains and products. So, once you find, say, a product that works really well for you, then you can kind of pull up the COA on it and, look at the terpene breakdown and the cannabinoid breakdown, and you can see what sets, this product or this strain apart from some of the others that you've tried that didn't work as well. And, there might be multiple things, but then you'll get to pick those out. You can note them in your journaling. And then, as you go on, you'll be able to narrow it down and say, oh, it's really this terpene and this, cannabinoid or ratio or what have you, that is my sweet spot, and then you'll be able to use that to stay in an area where you're not suffering from your symptoms. And it's very easy to access these. You'll notice in the picture of the product there in the bottom left, there's QR codes on them, and
Right there.
scan that with your phone. It'll pre-populate the batch number, which you can see in the middle with all the tiny stuff, but it's going to be a real long number. And that's what you're going to use to go to our website and enter that in. And then you're going to pull up this PDF that'll be multiple pages long, and we'll show you.
Yeah, it's important to point out that this is about 3 to 5 pages, depending on the product.
Right. Exactly.
And those QR codes are really important. You can also call your call center and they'll provide this information.
Right. So if you do get a batch number and it's not pulling up, you go to our website and it says it can't be found. If you call our call center or email info@trulieve.com and request a COA for a certain product and just give them the batch number, they will retrieve it for you.
Every product is tested. That's what's important. When they say batch number and sampling, every product here in Florida, and you should be able to see the results of the testing that was done on the product that you purchased and to guarantee the quality of it. That's important.
Exactly.
This is a little 9-pound hammer product up here. Look at that.
Yeah. Yep. One of the more popular ones for sleep.
Yeah, there you go. One of the other things that comes up is how do I get help? You have not only a call center, but you also have a consultation program. Why don't you explain that?
Yeah, absolutely. So our call center is going to be open 7 to 9 Monday through Friday, 9 to 8 on Saturday, 9 to 6 on Sunday. And we've got over 100 people there working, during those hours to take as many calls, answer as many questions, place as many orders as possible. Now, beyond the call center, we are very excited and proud to tell you about our virtual consultation program. So you'll see under the locations that we have here, this is a snippet from our locations page on our website. You'll see the third link under the photo. It says schedule virtual consultations. So these are specific to the location. Each store has a team of trained, seasoned, experienced individuals. Typically there's about 4 or 5 of them that only take these virtual consultations. You can schedule them through Microsoft Bookings, okay, and it'll block out a 30-minute time spot for you and a experienced member of our staff to go over any questions that you might have. And I definitely want to highlight that this service is 100% free, and it is open to anyone that is a patient or non-patient, and you can utilize it as many times as you'd like. And feel free to tell your friends if you've got someone from out of state that has questions. They can use it too. We're open to talking to anyone. We do use Microsoft Teams for the virtual face-to-face part, but if you're not very tech savvy, you're worried you probably won't get that to work, it's not an issue, as we do collect your phone number, and at the very least we can have a 30-minute phone call with you.
Yeah, so there is a way of staying in touch. Very important, because in many cases you want to talk through what you're doing, especially with respect to dosing in Trulieve products. One of the questions that comes up is, what product would you recommend for anxiety and PTS?
So
that won't increase anxiety. Excuse me. That won't increase anxiety.
That won't increase anxiety. Yeah, great question. And as we've kind of alluded to earlier, it's definitely going to be something that's going to have a CBD component in it, whether it be primarily a CBD product or a ratio product, and are going to want to start at least with the more of an indica leaning terpene profile. Now, I will say that I see many patients that utilize sativas predominantly for stress and anxiety, but again, in light of starting low and going slow and not knowing how you're going to react, it's just best to err on the side of caution, because you don't want to trigger any anxiety or panic. So start with the indica strains. But as we touched on with the Delta 8 products, I think those would be a great place to start, like the CBD Delta 8 1-to-1. I think that would be awesome for you to try.
Yeah. One of the questions that comes from an anonymous person says, you need focus and relief from an overwhelming anxiety, which depresses me. It interferes with my sleep. I've been experimenting at great expense with sublinguals, vape pens, and can't find it right. Any recommendations? I think this falls right into your consultation program.
Absolutely. Not only our consultation program, but our awesome return policy. Because if you're going through great expense, you don't have to do that with Trulieve, because we want you to land on something that's going to work. And if your products don't work, please return them to us and allow us to exchange them for something that's hopefully will. And kind of same thing goes for I guess same kind of product I'd probably like land you on, but definitely like high um, CBD components. And if you're suffering from sleep as well, there's a CBN capsules that are great for sleep, especially when combined with THC. So I think you've got a lot of things going on that you can attack in a lot of different ways. But it does need to be sorted out. I would recommend journaling if you're not already, and then definitely schedule a virtual consultation and see if one of our experienced staff members can kind of guide you to a better spot. And if you do have products, maybe they can set up an exchange for you as well.
One of the questions that we have here, again, another anonymous question, is what's the difference between capsules and edibles? They both seem to be like food.
Yes, right. So great question there. And so a capsule is going to be, just the capsule casing and then whatever concentrate or extract that we have in there, like the RSO oil. There can be a kind of a coconut oil component to aid in absorption, to have a fat carrier. And that's really going to be the only difference, aside from the ingredients that are in the edibles. So, you're going to have some sugar in those where you're not with the capsules. So that can, kind of change how, I guess, the onset time, how quickly it gets in your bloodstream, depending on what else is in your stomach. So in terms of how it's metabolized, edibles and capsules are just very, very similar. But in terms of onset and things, that's what can really vary. I would say the capsules would typically take longer to take effect than an edible would, but again, everyone's a little bit different.
Yeah. One of the questions that Michelle brought up is, how can you find the content breakdown, like CBD, when shopping online? Most dispensaries don't advertise or don't advertise the contents other than hybrid.
Right. And so that's going to be very difficult, other than knowing the strain until you actually kind of have product in hand and have a batch number to reference, because, we, can sell, say, a certain type of flower or a certain, concentrate, but it's going to vary in the amounts, that it has, depending on the batch, because, just slight variations in growing conditions can change the expression of certain cannabinoids and terpenes, even with the same exact genetic plant. So there's going to be such small variances that it would just be too consuming time wise to have to update that, especially with as fast as product moves. So the best thing would be to look at those COAs once you have the product. So if you go in store, you could check it before you purchase it, and that would really be the only way right now to know for certain.
But you do give, one thing I like about Trulieve is you do, when you click on the product and there's like a little learn more, it does tell you how much THC and CBD are in the products.
Typically, yes, it's just not going to be the exact number that's going to be in the product itself. It might be, but it's just not going to be confirmed until you get it. So we will give you an idea. It's just not going to be the exact one from the COA.
It's a pretty good guideline of what's in the product, and good guidelines as to what's there. And again, you'll nail down exactly what you're getting with the COAs when you're in the stores. One of the other questions that's come up is, are your bud tenders knowledgeable on epilepsy?
So I do know that we have a lot of employees, especially in the Central Florida area that I cover, that suffer from epilepsy or other similar conditions, and they're in this industry because medical cannabis does so much from them or for them. So I wouldn't say every person is going to have the same knowledge and expertise. We do have a lot of locations, a lot of employees, but I will say that there should be someone at each store that can help you out. Now, above all, obviously, always refer back to a licensed medical professional, whatever your doctor says. But absolutely, if you schedule a virtual consultation, I'm very confident that we'll be able to help you out and find you things that are beneficial specifically for your condition.
Sure. One of the questions that Sherry brought up is, what is a general cost of getting a medical marijuana card? I live in Titusville, and she's researched it, and she's seen the cards from $150 to over $300. Can I answer that one?
Yeah, go for it, Mark. That's your wheelhouse.
Yeah, I work with medical marijuana treatment clinics of Florida. I recommend them, and I would say go talk to them. And I do that for a couple of reasons. First of all, you will see cards. I've seen cards. Doctors recommend cards as low as $99. You'll see them at $150. And you have to be careful of not getting all the data on it. State of Florida requires you to have 2 doctor visits a year, one in the first 6 months, one in the second 6 months. What the doctor visit does is it verifies that you have a condition that qualifies for medical cannabis. By a doctor's visit, they're not doing an exam of you. All they're doing is, for the state of Florida, they're verifying that you have one of the state qualifying conditions, which I think there's now 16 of them. But more importantly, they've given the doctors the leeway to be able to look at those at your condition and be able to make recommendations on a like condition. So, for example, if you have chronic pain, it is a like condition to some of the conditions that are approved by Florida. There's about 400 or 500, over 400 different conditions that qualify you for a card in Florida. So if you don't see it on the qualifying conditions list in Florida, go see your medical cannabis doctor, because the Florida didn't need to list every one of those conditions. They gave that, the doctors know, the doctors can make that recommendation. Now, some doctors will say $99 for a card. You go to a hotel room, they give you a card for $99, and then you can't find them for the second half of the year. More importantly, you can't find them to call them and ask for help with your recommendations and your dosing. They don't exist. They kind of disappear. That's been the problem. The reason I work with MMTC is the cards will run you $399. That's for both visits. Okay, it's usually $199 for each visit. But with that, not only do you get the recommendation, but they have a call center. You can actually call them up. They have a phone number you can call, a call center. You can actually email them, and they'll help you work on getting your dosing right, and get the doctor involved with helping you get your dosing right. That is critical. Most doctors who have a practice during the day, they're practicing. They're hard to answer your phone. MMTC has been able to put practitioners on the line to be able to help you. And if they need to get right to your doctor, they will be able to do that. That is critical. It's not just giving you a card, it's helping you get your dosing right. And they also have other information that they provide on a regular basis. They have a website for CBD products that are doctor recommended, so you're getting quality products. They also have things like this webinar series that they sponsor. So they provide a lot of information. It's a lot more value than just a card in a registry. They let you be able to get the whole program right, get your regime right, and really help you be able to get your life right. So that's why I'm going to do a shameless plug on that, but I think they're the best ones that I've seen that's out there. And I'm not knocking any of the other doctors. There are good doctors that are out there. Again, find yourself a quality doctor that you can talk to, and it will be available if you need help. That's really critical. And obviously the ones that are available to you, they cost a little bit more money. But on the high side, you'll probably end up with something that's in the $350 to $400 range. It's in there. Alex, let's talk about your first time program, your loyalty program, your discount programs.
Yeah, since we're talking about costs, obviously we understand that it can be costly to just get in the program and into the space. One of the reasons why we have that amazing return policy. But I also want to point out our 2 new patient discounts. One of them is actually reoccurring. So the first one's going to be 15% off your entire order. Now we give that as the first discount because typically, you want to try a variety of different products. So, a percentage discount is the idea there. So on your second purchase, ideally you've kind of picked out some stuff that works, what works and what doesn't, and you can kind of just get up to the $150 mark, and then we'll take $75 off on your second order. Now, if you do want to switch those around, no big deal. And the $75 credit we actually give to every patient in the state annually. And we do that to offset the cost that you pay to the state to maintain your card and being active. So beyond that, we do have daily discounts. We give 20% off every order for veterans, and we have a financial hardship discount to SNAP and food stamp beneficiaries of 10% off every order. We also have a loyalty program that keeps track of, all of your purchases with us, and every dollar you spend gets you a point, and every 500 points gets you an additional 10% off that you can stack on top of other discounts that might be going on, typically up to 30%. And if they're not stackable, then we always do mention that on the sales. And we do have sales all the time. We do have a reoccurring Senior Sunday sale, discounts for seniors, and we also do statewide delivery 7 days a week, which we'll get into more later, as in right now. So which we've done from the beginning. So we've delivered statewide since day one, which we take a lot of pride in. Certain areas might have been twice a week, like the Keys, but now that we've got so many locations, we have easily statewide coverage, and it can be next day in most cases. So we're working on a same day option. It's just not here yet, but as long as we can get your order processed by 2 p.m., then typically scheduling next day delivery is going to be the standard.
And I love it because in many cases, especially for senior citizens, you deliver for free.
Exactly. Ever since the pandemic started, we've wiped out delivery fees for anyone that's 65 and older, and also any order over $200 is going to have no delivery fee either. And the delivery fees are just $15 anyway. So if you're really far away from a dispensary, or maybe yours is always kind of slam packed and you don't have time to wait, then delivery is a great option. We can bring it right to your door. We can bring it to, your place of business or any other location that you'd like to meet us, maybe across the street from your business. And they also arrive in unmarked cars. So they're going to be like small little transit vans or fleet vehicles with no markings on them. And someone in a white polo will just walk up with your white Trulieve bag, and that's going to be it.
I think that one of the questions that Leona came up with was, she asked the question that, will supply get better if rec goes through? She's talking about what it takes, that sometimes going to Trulieve, she's had some, she's had to wait. You not only, I think delivery is definitely an option for her, and then you don't have to wait for anything, but I think also you can make an appointment, right?
Yeah, exactly. Also, being in touch with our text updates for sales and inventories can also help with that, because, like I mentioned, we take a lot of pride in, doing half the dispensations every week, but that, means that we obviously move a lot of products. So, our most popular things, when they come in, they can go pretty fast in some cases. So it's really important to be able to be on top of knowing when that comes in, so you can place the order for it or go in to pick it up as well. And as far as rec, I don't think that's going to affect us very much in terms of our output, because we're trying to put out as much high quality medicine every single day as possible. So we feel like we're always trying to have our foot on the gas, 105%, 110%. So we're always just trying to do more and more.
Sure. I might want to point out, you have a lot of resources that people can tap into.
We do. So among our main website and our shop page, obviously, where you can find a lot of information on individual products, we also have a FAQ page, which answers a lot of questions for new patients, and also some general cannabis info on cannabinoids, terpenes, and a lot of the stuff we covered here today. And also we have a really informative blog. So there's lots of articles on there dealing with recipes, methods, or conditions, and how cannabis works with them specifically and whatnot. So a lot of great information there. We're also on YouTube, lots of educational videos, testimonies, which we call true talks and true stories. And we also have a cool video on YouTube that shows you a visual representation of our nanotechnology. So if you guys are bored, definitely go check that out. It's pretty cool to watch. And then we also have links to the Office of Medical Marijuana Use, the OMMU, their resource page, as well as links for research if you're interested in that as well.
Yep. Now, you also have your complimentary Facebook, Twitter, Instagram that you can actually follow.
Yes. So the best way to stay in touch with the sales is really going to be to have the social media notifications and text turned on.
So True Text opt-in, right?
Mm-hmm.
Yeah.
True Text opt-in. You got it. We have you can do it location specific too, and that'll be on our website.
Right. So let's kind of summarize everything. We've gone through a lot of things. We've gone through cannabis, the endocannabinoid system, how it works. We've gone through the products, the dosing, your products itself. Really boils down to is medical cannabis is really it's not a magic wand. It's more like fairy dust. To be candid with you, this is something that you use as in part of a balanced life. In other words, if you're having problems with anxiety and stress, talk to people. Consider your diet. Look at mindfulness things like meditation. Look at your basic self-care. Alex, what's your comments about being able to just but use medical cannabis in being able to change your life and your lifestyle?
Yeah. I mean, it's definitely a holistic type of approach that needs to be taken, right? When you're trying to do something like, get off all your pharmaceuticals, get your life back. Everything needs to be considered, your quality of sleep, your exercise, your diet, all these things are extremely important. And cannabis, can be a huge component of that, right? Because like Mark mentioned, like we are our own, cannabis kind of machines. We make our own endocannabinoids, and we're kind of just supplementing that system. But you can only undo so much, right? So the more beneficial things you're doing in other parts of your life, the more that you'll see, changes through medical cannabis.
And listen to your body. That's really important. I think it's that's really key. The point is, you get an opportunity to really address your body and to really help yourself. Take advantage of it. That's the best way of recommending it. This is not something where you take 2 pills and call me in the morning. This is something where it's holistic. It's more like a dietary supplement, something when you start, it's something you're going to continue to do. And if you do it, you will get your life back. Things will get better for you.
Yep. So. But it won't happen overnight. So be patient and journal and soak up as much information as you can, guys, because, whether it's, talking to your doctor, talking to dispensary staff, joining in informative webinars like this, if you, kind of hit a plateau where you're stuck and not able to, get to that next area of relief that you're looking for, somebody somewhere somehow will have, the information and will be able to relate it to you in a way that will allow you to get to the next step.
Yeah. So, and you're not alone. You don't look at this as something that you're alone and you're facing this thing again with anxiety. It's that whole thing of dread. Talk to people, find out what's out there. It's amazing to me when we address this subject in the seminars that we did live with people. It's amazing how many people lit up, and it was probably the most how should I say interactive sessions that we ever had. So again, don't look at it as you're alone, but really address it. And pay attention to it, because there is ways of managing that. Now, we have some references that we use to be able to put this webinar together. As I mentioned earlier, you will get an email follow-up that has the video, the YouTube video in it. It has this presentation. It has the CBD wheels. It has information on Trulieve, and more importantly, it also has on it the resources, the medical resources that you'll be able to see, to be able to address if you want to really dig down into the medical side and that type of thing. Alex, we've had a long webinar, a lot of questions asked. I think we had 39 questions, by the way.
Wow.
So my question is, we're going to wrap this up. What final thoughts do you have?
I mean, just piggybacking on what we were kind of onto, ask questions, get out in the cannabis community. It's a very compassionate space. Most people are very friendly, very willing to share what they know and talk about it. There's plenty of groups on Facebook, and lean on those. Lean on that as much as you can, as well as on your clinic, your physician, and our dispensary staff, and especially those virtual consultations. And don't forget about the return policy either. And we're just here to help. So we just want you to help. We just want to help you reach your goals through medical cannabis.
Well, and our goal really is to really help you get your life back. And again, if we can have one person come out of this webinar doing that, that'd be great. And obviously we'd like to have more than that, but there is a solution. You're not alone. And I think that's important. I want to point out that these webinars go on every week. Next week's webinar is on dosing. And so we're actually going to dig down. We have a couple of dosing experts from MMTC. We have Cameron Vance and Turner Davis. And it's a subject that's very, very important. I think probably one of the most important subjects with respect to using medical cannabis effectively. So please join us for next week's webinar. But I'd like to thank everybody for coming today to attend this. I know it's been long, a lot of information, but again, it's something that hopefully, again, when you're addressing anxiety and stress, hopefully will give you some solutions. Alex, thank you very much for what you've done. You've brought to the party some great information.
Hey, it's always a pleasure. Really appreciate you having me on here, and I'll plug the last one we did as well. If you guys have any interest in learning more about cannabis and chronic pain, you can go check out that webinar that we did previously as well. That's I was the guest host on there as well.
You did that. We did that last week. And by the way, you can go anytime you want to look up any of these webinars, you can go to Marijuana Aware. That's the website you use to register. If you look at a link at the top, it says follow up. Click on that and it has all the webinars that we're doing, not only this quarter, but also all the webinars we've done in the past by subject matter and also by date. So please feel free to do that. Our goal again is to help people and learn more about medical cannabis. So thank you very much for your time. And Alex, thank you for your time and your sponsorship, and everybody who came in today. We appreciate what you've done and we'd love to hear from you. Anyway, thank you and have a good weekend.
Absolutely.